Hello everyone, welcome to the channel Microbial World. Today let's learn about the bacterium Treponema pallidum, the causative agent of syphilis. Treponema pallidum is a spirochete bacterium. So what are spirochetes? Spirochetes are a type of bacteria characterized by its spiral helical shape. They are gram-negative bacteria. They are often free-living, but sometimes they can be pathogenic and cause diseases like syphilis, Lyme disease or leptospirosis. Treponema pallidum is responsible for causing syphilis, a sexually transmitted infection. Morphology. Treponema pallidum is a long, thin, helically coiled bacterium. It has a spiral or corkscrew shape, and this shape allows the bacterium to move efficiently through various tissues. The bacterium is very thin with a diameter of 0.2 to 0.5 micrometers and a length of 6 to 15 micrometers. The outer membrane of Treponema pallidum lacks bacterial cell wall components like peptidoglycan. It has outer sheath which surrounds the protoplasmic cylinder, and this outer sheath contributes to the bacterium's spiral shape. It has endoflagella. It is also known as axial filaments. This is located within the periplasmic space. Endoflagella allows the bacterium to move in a corkscrew fashion. Pathogenesis of Treponema pallidum involves a complex interaction between the bacterium and the host immune response. Treponema pallidum enters the body through direct contact with syphilitic lesion chancre. Chancre is a painless ulcer. The entry can occur during sexual activity or from mother to child during childbirth. The bacterium then multiplies locally at the site of entry and leads to the formation of chancre. It then spreads through the bloodstream and lymphatic system, leading to systemic infection. The host immune response to Treponema pallidum is primarily cell-mediated, involving T lymphocytes and macrophages. The bacterium has several mechanisms to evade the host immune response. Limited surface antigens. Treponema pallidum has limited number of surface proteins, making it less recognizable to the immune system. Low immunogenicity. The bacterium will induce a weak immune response, allowing it to evade detection and clearance. Tissue invasion. Treponema pallidum has the ability to invade and survive within host cells, including endothelial cells, fibroblast and macrophages, allowing it to evade the immune response. Clinical manifestations. Syphilis is a sexually transmitted infection caused by the bacterium Treponema pallidum. Syphilis is primarily transmitted through sexual contact, including vaginal, anal and oral sex. It can also be transmitted from mother to child during pregnancy or childbirth. This is called congenital syphilis. Stages of syphilis. Syphilis progresses in stages, and each stage has its own symptoms. Primary syphilis. Primary syphilis occurs 10 days to 3 months after exposure. Symptoms include chancre. Chancre is a painless, firm and round ulcer that appears at the site of infection such as genitals, anus or mouth. Lymphadenopathy, which means swollen lymph nodes near the site of chancre. Secondary syphilis begins 2 to 10 weeks after the appearance of the chancre. Symptoms include skin rash. This is a non-itchy rash that can appear anywhere on the body, but it commonly affects the palms of the hand and soles of the feet. Mucous membrane lesions. Condyloma lata. Condyloma lata are raised greyish-white lesions on moist areas such as genitals, anus or mouth. Systemic symptoms include fever, fatigue, malaise, headaches, muscle aches and sore throat. Other symptoms are lymphadenopathy, patchy hair loss. Patchy hair loss is also known as mouth-eaten alopecia. Latent syphilis begins after the secondary stage and can last for years. There will be no visible symptoms, but the infection will remain in the body and it can be detected through blood test. There is early latent syphilis and late latent syphilis. In case of early latent syphilis, the infection is within the first year after the primary and secondary stages. And in late latent syphilis, infection is more than 1 year after the primary and secondary stages. Tertiary syphilis occurs 10 to 30 years after initial infection if it is left untreated. Symptoms include severe damage to internal organs, including the heart, brain, and nerves. So, cardiovascular syphilis affects the heart. This can result in aortitis, that is the inflammation of aorta, and this can lead to aneurysm formation. Aortic regurgitation is the backward flow of blood due to damage to the aortic valve. Neurosyphilis affects the brain, and this can cause meningitis, which is the inflammation of the membrane surrounding the brain and spinal cord. Meningovascular syphilis is the inflammation of blood vessels supplying the brain. General paresis can cause progressive dementia and personality changes due to brain damage. Neurosyphilis can also result in tapes dorsalis. This is the degeneration of sensory nerve fibers, and it can cause pain, sensory loss, and ataxia. Gummatous syphilis is the formation of gummas in various organs including the skin, bone, liver, and heart. Gummas are soft tumor-like growths. Congenital syphilis. We had already said that syphilis can be transmitted from mother to child during pregnancy or childbirth. So, infants born to mothers with untreated syphilis can develop skin rashes. Skin rashes commonly occurs on the palms of the hands and soles of the feet, and it can be maculopapular or pustular. Bone and teeth abnormalities, deafness, central nervous system abnormalities such as developmental delays, seizures, or other neurological deficits. Hepatomegaly and splenomegaly, which is the enlargement of liver and spleen. Jaundice, that is yellow discoloration of skin and eyes. And it can also result in anemia, which is low level of red blood cells. Laboratory diagnosis. Non-treponemal test. Venereal disease research laboratory test or VDRL. This is a non-treponemal flocculation test that detects antibodies in the serum of patients with syphilis. So in this test, the patient's serum is mixed with cardiolipin cholesterol lecithin antigen, and the mixture is examined for flocculation or clumping under the microscope. Rapid plasma reagent test or RPR test. It is similar to VDRL but uses a different cardiolipin antigen complex. In this test, the patient's serum is mixed with RPR antigen and examined for flocculation. So in both these tests, the results are reported in titers such as 1:4, 1:8, 1:16, and a four-fold increase in titers indicates active infection or reinfection. Treponemal test. Fluorescent treponemal antibody absorption test. This is an indirect immunofluorescence test that detects antibodies specific to Treponema pallidum. This test is performed in such a way that the patient's serum is applied to slide containing fixed and stained Treponema pallidum antigens. If antibodies to Treponema pallidum are present, they will bind to the antigens and the slide is examined under fluorescence microscope. This test is more specific than non-treponemal test. Treponema pallidum particle agglutination assay. It is an agglutination test that detects antibodies specific to Treponema pallidum. In this test, the patient's serum is mixed with gel particles coated with Treponema pallidum antigens. If antibodies to Treponema pallidum are present, they will agglutinate the gel particles. Treponemal enzyme immunoassays and chemiluminescence immunoassays. These tests use enzymes or chemiluminescent labels to detect antibodies specific to Treponema pallidum. So in this test, the patient's serum is added to wells containing Treponema pallidum antigens. If antibodies to Treponema pallidum are present, they will bind to the antigens. And the presence of bound antibodies is detected using an enzyme or chemiluminescent label. This test is used for screening and confirmation. Direct detection methods. Dark field microscopy is a microscopic technique that allows direct visualization of Treponema pallidum in clinical samples. So fluid from chancre, lesion exudate and cerebral spinal fluid is examined under dark field microscopy, which eliminates the bacteria against a dark background. This method is highly specific, but it is less sensitive due to low number of bacteria in clinical samples. Polymerase chain reaction is a molecular technique that detects Treponema pallidum DNA in clinical samples. So the DNA is extracted from the clinical samples and specific regions of Treponema pallidum DNA is amplified using PCR. The presence of amplified DNA is detected using gel electrophoresis or other detection methods. It is highly specific and sensitive, but it is not widely used in routine practice. Treatment of Treponema pallidum infection involves the use of antibiotics. In case of early syphilis, benzathine penicillin G is administered, and doxycycline and tetracycline is an alternative for penicillin allergy. In case of late latent syphilis, tertiary syphilis and neurosyphilis, benzathine penicillin G or aqueous crystalline penicillin G can be given. And doxycycline, tetracycline and ceftriaxone are given to individuals who are allergic to penicillin. In congenital syphilis, aqueous crystalline penicillin G is administered and doxycycline is the alternative for penicillin allergy. Syphilis can be prevented by abstinence from sexual activity or mutual monogamy with an uninfected partner, proper use of condoms during sexual activity, and regular screening and early treatment for syphilis and other sexually transmitted infections. Thank you for watching. Subscribe to the channel for more informative videos.